Okay, hello, welcome back to the channel, Boulder Pain Relief Massage here in Boulder, Colorado. This is Lao Kemper. Today's video is about a very important issue, and it's one of my specialties relating to the jaw. A lot of people ask, what is TMJ? Why do I have it? Etc. And a lot of people don't understand that there are a lot of muscles involved in this pattern. One thing I like to tell all of my clients and patients when I'm starting to work in this area is everybody has TMJ. TMJ, if you can see here, is the location and the name of a joint. It's where the temporal bone meets the mandibular bone, so it's called the temporomandibular joint. So everybody has TMJ. We all have two. They're just the name of joints on the either side of where our mandible, which is one bone, where that bone meets the skull. And so this is a critical area. A lot of people have issues in the jaw and they don't know what to do about it. And so I'm going to speak to this a little bit. If you have, let's just say, clicking to start in the jaw. What is clicking? What is TMJ? We explained that, but clicking is, if you can see here, in all of our jaws, there's a little disc. It's called the articular disc. It's a cartilaginous disc, and that sits in between the joint. And I often like to think of this as a door hinge. A good door hinge keeps the door where it's supposed to be and rotates around that axis beautifully, and it helps kind of lubricate that motion. This area here, if this disc is imbalanced, i.e. there's too much tension pulling on this from these muscles, particularly the lateral pterygoid muscle through here, if these muscles are too tight, what tends to happen, and it's usually on one side more than the other, is that if this is your jaw and these are your teeth, this is where it's meeting your skull, when our jaw opens and closes, if this disc is getting pulled, that clicking, whether you can feel it or hear it, it's sometimes subtle, but it can bother people quite a lot. When the jaw opens and closes, it can actually unseat and then reseat that disc right where it's supposed to be in that joint, in the TMJ joint. And so because of that, if there is too much pulling power on that muscle, that can cause that clicking. So just like working anywhere in the body, and this is my specialty, if we can calibrate the tension pulling on the muscles involved in these joints, then there's very little reason for there to be clicking or discomfort. So this is a little bit about the TMJ, clicking. And if you are struggling with clicking in your joint, in your jaw, you're having mild manifestations of it, it's annoying or it's fully problematic, or you're experiencing pain, see if you can find someone in your area, or come and see me in Boulder, Colorado at my practice out of CrossFit Sanitas, and I can certainly help you. Dentists send me a lot of people for this specialty, and a lot of us don't realize that around the head and around the face, every single motion of the jaw, of the micro expressions or broader expressions of the face, there's a muscle that does that. And so if we can make sure that the pulling power here is balanced, no problem. The jaw feels much better. It tracks uniformly in the way that it's supposed to with minimal discomfort, better range. And just like anything, whether it's a shoulder or a hand, if we make sure that the tissue is in relatively stable balance as far as the antagonistic muscle groups that are working on that joint, the body works beautifully. So if you have any questions, please leave them in the comments below. Happy to answer those as they come in through the inbox here or through LinkedIn. But please answer or leave me some questions so that I can answer those questions that are coming up for people. A lot of people don't understand soft tissue, and I'm wanting to share and teach so that, if nothing else, we can just reduce the amount of discomfort we're all in. All right, have a great day.